Well, let's get some more on this now, and for that we'll turn to Gregory. He's the Executive Director of the National Rural Health Alliance. He's in Canberra this afternoon and he joins me from our studio there. Gregory, thank you very much for talking to Afternoon Live. Does this package rise to the needs of rural and regional Australia?
Well, certainly, Nick, yes. The announcements made are very, very exciting. This is a great day for the mouth, to be dragged, as it were, screaming and kicking back into the body, to be, part of primary care. The programs for the bush, the critical thing, as we've always said in the Rural Health Alliance, for which I work, is that to do anything useful in dental health in rural areas, you need to fix the workforce first, because we're so short of dentists and oral therapists and hygienists as well. So we're very pleased that, I think the figure I heard was $250 million is going to be used for infrastructure and for workforce, much of which we hope and assume will be spent in rural and remote areas.
Okay. For years now, health experts have been decrying the plight of many Australians, the poor state of dental health in this country. And you were mentioning there a moment ago the fact that the mouth has been dragged back into the body. And that's a reference, isn't it, to the fact that for a long time the mouth was excluded from the Medicare coverage that a lot of Australians enjoyed.
For what reason? I mean, apart from governments fighting with each other and saving costs, one can't be sure, because I'm sure people are well aware that poor oral and dental health impacts on your general health and also has significant social and indeed economic costs, because of course it affects productivity. If you can't go to work, if you're not comfortable, if you can't eat properly. So, it's been a long time coming, but we, the Rural Health Alliance, are very, very strongly supportive of this. We need, of course, to wait and see how the programs are going to be rolled out. I mean, I've already done some radio interviews today when people have said, what can I expect tomorrow? I mean, this is an announcement which has got to be followed through, and we're sure it will be. The states have got to do their thing, meaning that hopefully there should be no reduction in the effort, meaning the expenditure of the states, because with the Commonwealth now responsible for 3.4 million, I think the number is, of school kids in terms of their oral and dental health, then the states can do more for low-income adults, and that's the division that's been announced today. So we, the public, and we, the advocacy organisations like the one for which I work, will be trying to make sure the states do keep their effort up and don't cheat on the system, don't cheat on the partnership, as it were.
Yes, and of course it's one thing to make dentistry more affordable to more Australians, but of course the problem that many Australians face in rural and regional areas is that it is just impossible to get to see a dentist.
Well, that's right. I mean, there are two things. Firstly, we're very, very short of oral health professionals, including dentists. And secondly, the price precludes many people from going to a fee-for-service private dentist if there is one. So that's why the programs, which let me just give you some idea for what they are. Firstly, there is going to be a foundation year for new graduates of dentistry, and some of those 100 places, or many of them we hope, will be focused in rural areas. There is, as I said, the money for infrastructure. There is a so-called relocation scheme to try to encourage city dentists to move to country areas for 6 months, forever, who knows. And there are also significant changes in the scope of practice for oral hygienists and oral therapists, and they are slightly better distributed in rural areas than dentists, so that if we can distribute the work on the mouth and the gums that needs to be done between those different professions, again, rural people will be advantaged. But I say again, let's hope, let's be confident, let's keep the pressure on, because the announcements have been made. We now want to see these programs rolling out as soon as possible so that we can have some greater equity in rural and remote areas and for people on low incomes.
Okay, well, implementation is something else again. But look, I asked this question, Gregory, to ACOS last hour. Is there anything you don't like about this package?
Well, not really. I mean, it's a major step forward. It is establishing in what you might call the mainstream of budget expenditures through programs which are there, can be seen, are accountable. It's got a very sensible division of responsibility now between the Commonwealth and the states, which, as I say, we assume the states will pick up with alacrity, because there's a lot of money on the table. And so, I mean, one could criticise the fact that it's been a long time coming, but that's not fair. No, it's good. It's a good start, and hopefully you know, it's the beginning of much, much better times, for much more sensible times, much more effective times for the treatment of oral health and dental health care, and for the provision of services, particularly, may I say, in rural and remote areas.
Okay, Gordon Gregory, thanks for giving us the reaction of the National Rural Health Alliance.
Thank you, Nick.